Let's shift gears now, and tonight on Corona Watch, we focus on how Kenya and her neighbors are approaching the COVID-19 pandemic differently. Now, Kenya and Tanzania are next-door neighbors who share a border, a language, and a long collective history of cooperation. Tonight, we look at how these sister states have responded to the COVID-19 pandemic and the resultant events that have threatened to aggravate diplomatic tensions between the two nations. So let's begin with a timeline of events in the two countries since the onset of the pandemic. And we want to start with Kenya's timeline. Now, on the 13th of March, the first case of COVID-19 was reported in Kenya. And on the 20th of March, 1 week after the first case was reported, Health Cabinet Secretary Mutahi Kagwe responded by calling for all entertainment establishments, including bars and restaurants, to be closed by 7:30 p.m. starting on the 23rd of March, while he further ordered for the suspension of all international flights effective from the 25th of March, with exception of cargo. Now, 2 days later, on the 22nd of March, Cabinet Secretary Kagwe ordered all restaurants to operate on a takeaway basis only after the confirmed cases rose to 15. And by the 27th of March, a nationwide dusk-to-dawn curfew was imposed by President Kenyatta. Now, this curfew was extended for another 21 days on the 25th of April. But days later, restaurants and eateries were given the green light to reopen for service in a bid to save businesses on the edge of collapse. And so, by the 16th of May, President Uhuru Kenyatta extended the curfew by an additional 21 days after the confirmed cases rose to a total of 781, more than double the amount reported just 3 weeks earlier. On the same day, President Kenyatta also ordered for the closure of the Kenya-Tanzania and the Kenya-Somalia borders. This after mandatory testing at the borders showed that out of the 53 drivers that tested positive for COVID-19, 51 of them came from Tanzania. Now, Tanzania was quick to retaliate, and on the 18th of May, Tanzania banned Kenyan lorries from entering the country, saying that Kenya was the cause of the spread of the virus in Tanzania. As of 19th May, 214 positive cases had been detected at the Kenya-Tanzania border. So that has been Kenya's timeline and approach. Now, let's change and look at what has been happening in Tanzania. Now, Tanzania's timeline begins on the 16th of March 2020. 3 days after Kenya's first case was recorded, Tanzania reported its first case of COVID-19. A day after, on the 17th of March, the Tanzanian Prime Minister Kassim Majaliwa called for a 30-day ban on public gatherings, including schools, sports and music events, political meetings and community events. But on the 23rd of March, Tanzanian President John Magufuli encouraged the public to continue to attend places of worship. He said, and I quote, "We are not closing places of worship. That is where there is true healing," end quote. Now, on the 4th of May, President Magufuli stated his plans to import Madagascar's traditional remedy believed to cure COVID-19. Still emphasizing the need to look to traditional and natural remedies, on the 17th of May, Magufuli announced that his son had recovered from the coronavirus by isolating in his room and drinking a hot lemon and ginger drink. At the same time, President Magufuli declared that he had also tested the tests by secretly sending samples from pawpaws and goats to be tested for COVID-19, and that they came back positive. Magufuli argued that faulty kits were the design of Western powers. He therefore cast doubt on the reporting of the global pandemic itself, urging Tanzanians not to take it seriously. Then, on the 14th of April, the Prime Minister extended the closure of schools indefinitely. But not even a week later, President Magufuli announced that schools would be opening on the 1st of June. On the same day, he announced that he had spoken with President Kenyatta and that the border row regarding COVID-19 would be amicably solved. Following these timelines and responses by the two neighbors, how then have the countries fared against COVID-19 so far? Well, as the graphs indicate, Kenya has more cases in terms of infections, deaths, and even recoveries. But remember, Kenya is also testing more people. It is also important to note that the Tanzania figures demonstrate a sharp spike in infection numbers from 53 to 509 in just 10 days, while the Kenyan figures show a steady climb. But we want to take just a quick moment now and compare what we have seen in Tanzania, particularly with the case of Brazil. So let's take a look now at the Brazilian case. Now, Brazil currently has the third highest number of COVID-19 confirmed cases in the world, totaling more than 250,000. President Bolsonaro referred to the virus as a little flu and attempted to organize campaigns completely ignoring WHO's social distancing advice. Bolsonaro has also been very vocal about keeping churches open, referring to preventative measures as hysterical. Well, time will tell whether President Magufuli's approach was right. After the break, we want to speak then to East Africa Community and Regional Development Cabinet Secretary Aden Mohamed. He'll be telling us about Kenya-Tanzania relations. And then a little later on the program, controversial Embakasi East MP Babu Owino joins us on Punchline. Stay with us.